Hi, I'm Dr. Casey Jones, and if you're watching this video, it's probably because you are interested in oral appliance therapy or mandibular advancement device therapy in order to treat your obstructive sleep apnea. So, I'm making this video to help you understand what getting treatment here at Inspired Dental Wellness might look like. So, the first thing that would happen is that I would review with you that sleep study that's been sent to me by your sleep physician, your referring physician, so maybe your primary care. And we go over that because sometimes I don't know what you understand already about your disease. So, we would talk about the number of times that you're breathing badly or stopping breathing. What types of things might be able to help? For example, if you stop breathing or struggle more when you're on your back, which is really common because the airway is more likely to collapse with the gravity and the tongue is more likely to fall back, then maybe positional therapy or finding a way to sleep on your side might be a part of this. We also will do a comprehensive exam to look at what is your airway like? Do you have a lot of tissue in the back of your throat? Do you have a large tongue? What motions can you do with your tongue? How strong are your muscles? Myofunctional review. We're doing an oral cancer screening. We have a screening tool in order to help determine what it would be like to treat you with an appliance and how effective that might be. How collapsible is your airway? All of these are pieces of it because it's not magic. It's not simply that we're going to put this device in your mouth and you're going to have the best night of sleep ever. So, what would this device look like, right? There's a whole bunch of different types of it, and no study has shown that any one appliance is more effective than the other. But this is one type. So, this is printed nylon, it's Panthera, and you would wear this. All of them have some sort of way of moving the jaw forward. They're attached, and we only want to bring the jaw as far forward and open you enough just to help you be able to breathe. We are not trying to affect the jaw joint, although that is a risk. We're not trying to change your bite, although that is a risk. But being able to breathe sort of trumps all that, in my opinion. And we do things to manage that, like myofunctional therapy exercises every morning, like having an AM aligner or a morning repositioner that you wear every morning in order to try to prevent those changes. So it's a custom made jig of some sort. This is one type that you put in and it reminds you where your normal bite is. Okay, so that's one way. We've also got this type. So this has things that you adjust on each side. We teach you how to do this. And so that's another type that's very popular. This is similar, but another one where you have a tool that goes in here to move it forward. Some of them move a fraction of a millimeter, some of them move a millimeter at a time. Here's another type where it's not actually connected, so changing the trays help to move things forward. What else do we have? I mean, there's so many different types. This is another one. And so you change this in order to move the jaw forward. So again, no study shows that any one of these devices is more effective in treating it. It just sort of depends on, do you clench and grind, which can be a symptom of sleep apnea untreated? Do you have a preference on the material that's used, on the fit of it? We try to make this decision together because we are meeting you where you are and partnering with you on this journey. Now, just having this device in, and even if you feel like it's super effective, that doesn't mean that it is effective in treating the obstructive sleep apnea. And there's no way really to know other than to test it. So we have these screeners that we allow you to use as part of your therapy. So the therapy does include the 90 days of follow-up where we work together to figure out what's most effective for you. And this is something that you get to essentially rent from us as part of it. And you wear it every night. All right. So when you put it on your finger of choice, it is going to turn on and it will then measure your oxygen level and your pulse. So it's not a sleep study, but it is a screener that allows me to determine how many times, an indication of how many times you're either breathing badly or stopping breathing throughout the night so that I can help you know, okay, let's move it forward. Let's dial it back. How do we treat this? What else is going on? Did you have alcohol last night, which maybe helps to make the airway more collapsible? And that's why your numbers are worse. What are these pieces of the puzzle? So all of that, again, is included in this appliance therapy. It's not as simple as you get this appliance and that's it, right? But even once we feel like it is effective, then you have to have a sleep study done with whichever appliance you have in place in order to confirm that this is in fact effective. Because for some people, it's not, and there is no guarantee that it will be effective for you, but it's a highly effective way of treating. And if people aren't going to use positive airway pressure or CPAP, there are other options, including this, including myofunctional therapy, which is kind of like physical therapy for the tongue and airway. And we are going to help maximize any insurance benefit that we can towards this. So oftentimes there's medical insurance benefit that can be used towards this appliance. We have a medical billing team that is dedicated to helping you maximize any benefit that you might have. It is not covered in that it's never 100% paid for. That's not how medical insurance works, unfortunately. But it is often that you have some benefit to go towards it. So they work on your behalf to do that. We are out of network with all medical insurances. There's just way too many of them to be in network, but we will do our best to help maximize that. So the cost of the appliance is due when we do the appliance therapy, and then any reimbursement that comes from your medical insurance will go directly to you. And again, we do our best to help with that, but the insurance companies never tell us how much they're going to pay, so we can never guarantee. But we will always tell you how much the therapy is going to cost and try to keep you as informed as possible. So hopefully this helped to explain a little bit about what we're going to do here at Inspired Dental Wellness. Again, it might be a little bit different because the other piece that we're looking at is your breathing. So dysfunctional breathing comes into play so often with sleep disordered breathing, because if you're not breathing well during the day, then you're certainly not breathing well at night, and we can retrain that. So for example, if you are breathing through your mouth instead of your nose, you are going to not only be opening up the airway, or excuse me, opening up your mouth, which closes off the airway, because that's where it is right there. So it makes a smaller hole just by opening up your mouth structurally. And if you are breathing through your mouth, this is a bigger hole than here. So you're going to be pulling more air through. And if you have something that is prone to collapsing, if you're bringing more air through it, it's going to be more likely to collapse. For example, if you are sucking through a straw and you're doing it lightly, it will stay open. However, if you go, then it's likely that it's going to collapse, and a collapsible or compliant airway that is prone to collapsing is going to collapse under that stress. So if we can retrain you to be breathing through your nose, then that's helpful. We can help to determine, is it structural or is it a habit? Is it inflammation? And help you to navigate that. So have a fantastic day. Don't forget to smile and dance. Look for the blessings, and I promise you'll see them. Have a great one.